everyone, my name is Hanya and this is my capstone assignment. Imagine you're feeling really depressed and anxious. You've tried therapy, you've tried medication, but nothing is really seeming to click. Now, what if the answer lies in your gut and therefore what you eat? Today, I want to talk about how our diet can affect how we feel and who we become. Before I get straight into it, I just want to talk about how intense the emerging problem of depression is. Over 280 million people worldwide suffer with depression, and despite some of these people having access to medication, only one-third of patients prescribed with antidepressants find that it actually works. Now, what if this is because we've been treating our brain in isolation this whole time, and in reality, depression is not an issue that lies purely in the brain, it's in the whole body. Your gut is talking to your brain. This is something that is a little bit crazy to think about, but this is through the gut-brain axis. The gut-brain axis has three pathways in which it's able to communicate through our brain. The neural pathway, it has the vagus nerve, which connects the brainstem to the gut. It also has immune signaling, and microbial chemicals. So those are the three pathways. I really like this diagram on the right because it shows things that we did not know about this gut-brain axis. Now, we do know on the left side that our gut and brain have to do with our weight gain, bowel movements, nutrient delivery, and microbial balance. But did we know that it also has an influence on neurotransmitters that are being transmitted, stress, anxiety, mood, and behavior? One key statistic is that 90% of our serotonin is made purely in the gut. I also found that specific gut microbes, when injected into mice, were proven to improve the mood of mice, keep them calmer and less anxious. Diverse microbes in general are also just linked to lower stress hormone levels. So now that we know that our gut and brain are in constant communication, how can we influence the conversation that they're having? How can we make this conversation more beneficial for us? We all know that when we're eating McDonald's and unhealthy food, we end up feeling sluggish and a little bit lazy, right? That's no surprise. Ultra-processed food has an increase in depression and anxiety symptoms, and minimally processed food, fresh whole foods have a decrease in depression and anxiety system. Unhealthy diets also lead to less microbial diversity, increased inflammation, and like I said, increased mental disorders, while a healthier diet does lead to more beneficial microbes, less stress hormones, and definitely less depression issues. So this is just telling you guys that it's more important to eat fiber-rich, fermented foods that are whole rather than eating high sugar, high fat, processed foods that could be potentially harming your mental health. Now, I really like this diagram here on the left because it connects specific bacteria to specific mental disorders. So far we've talked about the fact that gut microbes can affect how we feel and how we can affect that conversation through what we're eating. But what if we can go more intentional with this by taking specific strains of bacteria to improve our mood? We all know the word probiotics, right? It's those pills that we take sometimes to just improve our digestion and improve our gut. Now, there's something else called psychobiotics. Psychobiotics are also probiotics, but they're known to help improve your mood. They can help with things like depression, anxiety, and stress. And there's specific strains of bacteria like Lactobacillus rhamnosus and Bifidobacterium longum that have been shown to produce specific GABA and short-chain fatty acids, which play a role in calming our nervous system and therefore reducing inflammation, which are two things that we know are directly connected to depression and anxiety. In another review done by Sarkar et al., they show clinical trials that specifically use strains that were proven to reduce your cortisol and improve your sleep. And they found that this worked not only in animals, but also in humans. So the big takeaway here is the fact that we can not only alter our diet to improve our mental health, but we can also use specific psychobiotics or probiotics that have to do with these strains that are connected to specific mental disorders to help heal us. In conclusion, your gut microbiome does play a role in your mood and your emotions. Mental health ties in with the health of your overall body, and we can do our part by eating healthy foods, possibly taking probiotics to improve our mental health, and just being very intentional with what we're doing to balance the microbes in our gut, therefore balance our hormones in our brain through our gut-brain axis. Probiotics cannot replace therapy. Your diet cannot replace therapy. And kale definitely does not cure depression. But I just want everyone to start think of mental health as a whole body issue rather than something that is only in the brain. So instead of just only relying on something that is proven to help your brain, maybe you can heal your body at the same time. And before I leave, I want to leave you all with one question. How different would the mental health statistics that we talked about in the beginning look if we all prioritize our gut health and what we are eating? Thank you.